Gestalt therapy is a psychotherapeutic approach developed in the late 1940s and early 1950s by Fritz Perls, Laura Perls, and Paul Goodman. Based on the principles of Gestalt psychology, this therapy emphasizes personal responsibility and focuses on the individual's experience in the present moment, the therapist-client relationship, the environmental and social context of a person's life, and the self-regulating adjustments people make as a result of their overall situation. Historical context and foundations. Origins in Gestalt psychology. Gestalt psychology, which emerged in Germany in the early 20th century, focuses on how people interpret and give meaning to experiences. It posits that the whole of anything is greater than its parts, and stresses the importance of context and perception in understanding behavior and thought processes. Development of Gestalt therapy. Fritz and Laura Perls, along with Paul Goodman, developed Gestalt therapy, integrating elements from psychoanalysis, existential philosophy, and holistic thinking. This approach was a response to the perceived limitations of traditional psychoanalytic therapy, and a reflection of the changing cultural and social milieu of the mid-20th century. Key principles of Gestalt therapy. Here and now focus. Gestalt therapy encourages clients to focus on the present moment, rather than dwell on past experiences or future anxieties. This emphasis helps individuals become more aware of what they are thinking, feeling, and doing in the present moment. Awareness. Central to Gestalt therapy is the concept of awareness, understanding oneself and one's environment in a way that is spontaneous and unfiltered by preconceived ideas. Holistic nature. Gestalt therapy views individuals as integrated wholes, considering mind, body, and soul. It emphasizes that understanding oneself requires a comprehensive view of all aspects of one's being. Responsibility and self-regulation. The therapy stresses the importance of personal responsibility for one's thoughts, feelings, and actions. It posits that individuals are capable of self-regulation when they are aware of their needs and environmental circumstances. Techniques and methods. Dialogue and ideal relationship. The therapist-client relationship is crucial in Gestalt therapy. Therapists engage clients in a dialogue that is genuine and focused on understanding the client's perspective. Experiments and exercises. Gestalt therapists often use creative and experiential techniques, such as role-playing, to help clients gain insights and resolve internal conflicts. Empty chair technique. This is a well-known Gestalt therapy technique where a client dialogues with an imaginary person, or a part of themselves, seated in an empty chair. This method helps in exploring emotions and perspectives. Applications and effectiveness. Gestalt therapy has been applied in various settings, including individual and group therapy, and has been used to treat a wide range of issues like anxiety, depression, and relationship problems. While its effectiveness varies depending on the individual and the issue being addressed, many find its focus on self-awareness and present experiences to be profoundly helpful. Criticisms and limitations. Lack of standardized methodology. Critics argue that Gestalt therapy lacks a standardized approach, which can lead to inconsistencies in its application. Limited research base. Compared to other therapies like cognitive behavioral therapy, CBT, Gestalt therapy has a relatively limited research base, making it difficult to assess its effectiveness systematically. Intense emotional experience. The therapy's focus on exploring deep emotions can be overwhelming for some clients, especially those with severe psychological disorders. From a personal perspective, Gestalt therapy's emphasis on awareness and the present moment is both its strength and a potential limitation. Its approach to understanding and integrating various aspects of an individual's personality and experience can be profoundly transformative. However, its effectiveness is highly dependent on the skill of the therapist and the client's willingness to engage in deep self-exploration. While it may not suit everyone, especially those looking for more structured approaches like CBT, Gestalt therapy offers valuable insights and tools for those seeking to enhance self-awareness and personal growth. In the evolving landscape of psychotherapy, Gestalt therapy continues to maintain its relevance, adapting to the changing needs and complexities of modern society. This adaptability is evident in its application across diverse cultural contexts, and in addressing contemporary issues such as identity crises, existential anxieties, and digital age stressors. Integration with other therapies. Gestalt therapy's principles have been integrated with other therapeutic approaches, such as mindfulness-based therapies and cognitive behavioral techniques, enriching and diversifying the scope of psychotherapeutic interventions. Application in diverse settings. Beyond individual therapy, Gestalt methods have been adapted for use in group settings, organizational development, and educational contexts, demonstrating its versatility and broad applicability. Emphasis on body awareness. With growing recognition of the mind-body connection, Gestalt therapy's focus on bodily sensations and experiences resonates with contemporary approaches that address psychosomatic symptoms and stress-related disorders. The therapeutic relationship in Gestalt therapy. One of the most distinctive aspects of Gestalt therapy is the nature of the therapeutic relationship. The therapist is not seen as an authoritative expert, but rather as a facilitator or guide who assists the client in their self-discovery journey. This egalitarian approach fosters a sense of empowerment in clients, encouraging them to take charge of their healing process. Authentic encounter. Gestalt therapists strive for authenticity in the therapeutic relationship, often sharing their own experiences and emotions in the session, which can deepen the client's insight and connection. Therapist as a mirror. The therapist acts as a mirror, reflecting the client's behaviors, thoughts, and emotions, helping them gain a clearer understanding of themselves. Therapeutic challenges. Gestalt therapists may challenge clients' perceptions and behaviors, facilitating a deeper exploration of their internal conflicts and unresolved issues. Gestalt therapy in group settings. Gestalt therapy is notably effective in group settings, where participants can explore their interpersonal relationships and social dynamics in a supportive environment. Group dynamics. The group setting allows clients to experience and analyze their interactions with others, providing a microcosm of their external social relationships. Feedback and support. Participants offer each other feedback and support, fostering a sense of community and shared understanding that can be therapeutic in itself. Role-playing and experiential learning. In groups, role-playing and other experiential exercises are used to simulate real-life situations, helping participants to explore and resolve interpersonal issues. Future directions and potential. Looking ahead, Gestalt therapy has the potential to evolve and contribute significantly to the field of mental health. Its emphasis on holistic healing, mindfulness, and self-awareness aligns well with current trends in mental health care. Moreover, its adaptability suggests that it could effectively address emerging psychological issues and cater to diverse populations. Technological integration. With the rise of digital technology in therapy, Gestalt principles could be incorporated into online counseling and virtual reality interventions, reaching a wider audience. Research and evidence-based practice. Enhancing research on Gestalt therapy will strengthen its credibility and allow for its integration into mainstream mental health services. Training and education. Investing in the training of Gestalt therapists, ensuring they are equipped with the skills to address a range of issues in various settings, will be crucial for the continued growth and effectiveness of this therapeutic approach. In conclusion, Gestalt therapy remains a vibrant and influential force in the field of psychotherapy. Its focus on the present moment, holistic view of the human experience, and emphasis on personal responsibility and self-awareness are invaluable in a world that is increasingly complex and challenging. While it requires a high level of commitment from both the therapist and the client, its potential for profound personal growth and healing is significant. As mental health practices continue to evolve, Gestalt therapy's principles and techniques will likely continue to be a source of inspiration and innovation in helping individuals lead more integrated and fulfilling. House of Thought Therapy. Nurturing minds, empowering lives.